Hospital infections, cleaner hospitals, hand washing and antimicrobial resistance are all health-related issues which are frequently in the news and which cause concern to both the healthcare profession and the general public. The prevention and control of hospital infections is a priority for the NHS, and surveillance of these infections is key if the war against the superbugs is to be won. We will be hearing the views of Derek Butler, chairman of MRSA Action UK, the charity set up to raise public awareness and to influence government and healthcare providers in the fight to prevent MRSA and other hospital superbugs. We also hear from leading anti-superbug innovators, Cambio Healthcare Systems, Acquisition Limited and SystemSolve Limited, who share their knowledge of fighting hospital infections and talk about the research and development that has gone into developing their anti-superbug innovations.
MRSA Action UK is a small charity that was formed 3 years ago by a group of people who met on the MRSA discussion forum. And at that time, about 11 of us had all been affected by MRSA in one way or another, hence the name of the charity. We now cover all healthcare infections, but we formed that name because of that principle that we'd all been affected by MRSA. But at that time, there was no charity in this country to support and campaign for better standards in our hospitals, but to support the sufferers. When we had actually lost someone or suffered from this bacterium, there was nobody there. So we wanted to have a group and a charity, but we didn't want to just stay as a charity. We wanted to be much more than that, and we've got a very good success record. But the bugs are in the hospitals and we can't get them out, and we will never get them out. What we have to do is to control them in those hospitals to make sure patients are not affected or infected by these bacteria. But a lot of us carry this bacteria on our skin harmlessly. So it's not the big superbug and the big threat, but it can kill, and it has killed in the past. My message to the staff in the NHS and to the government and to the Department of Health and the regulators, who have done a marvellous job in bringing infections down from a very high rate, although I say from a very high rate because it was started from there, I have this simple message: do not pop the champagne corks yet. We haven't beaten these bugs. Those bugs are still higher now than they were in 1997. We have a long way to go. We have come a long way, but we've done the easy part. By attaining the 50% reduction set by John Reid, which many people thought we couldn't attain, you've done very well. But the bigger battle lies ahead. Reducing them down to a level that is acceptable not only to us, but to the public who we serve, has to be lower than it is now. Do not accept that you've done well. You have, but not well enough. We need to go that extra mile, and we need to go to the next level and the next stage. But well done to the staff, well done to the government. You've done well to begin with, but let's carry that on. Let's not throw away the success we've had up to now. Computer software is a tool that can be used very efficiently with keeping patients' records on computers for infections and treatments. So wherever that patient goes, it's easily accessible, because you may be in Scotland being treated, catch a superbug, MRSA or C. diff, and then you may move down south to Brighton. So though your notes go with you, there's only your notes. What we need is a proper centralised computer database so that we can access it, or we can't, but the medical staff can access it to find out if that patient's been exposed to MRSA, C. diff or any other superbug. And that technology can help us in the fight. And it'll also keep an accurate record of what the hospital's doing as well, because they need to computerise their records of how many infections they've had, the trends, because with a computer you can actually put up systems that will show you trends. Instead of relying on paper or doctors or nurses, suddenly it will flag up a trend. And industry use that kind of thing, especially the aircraft industry and the nuclear industry, and the food industry does. They use computers to show for trends, and the NHS and the medical profession can do the same.
Cambio Healthcare Systems are Scandinavia's market leader in electronic patient record systems. We've implemented county-wide systems from the GP up to the university hospital, with everyone sharing the same electronic patient record and having access to electronic ordering and e-prescribing. This means that everyone can access the same information at the same time and reduces the need, virtually eliminates paperwork. So Swedish hospitals have very efficient processes and virtually paperless. Cambio's vision is to create electronic health solutions that support exceptional care at every stage of a patient's life. To us, high technology is just a means to a goal of creating a more efficient healthcare process, which ultimately means better care for the patient at the end of the day. Now, we've been in the UK since 2004. We have a UK presence and a UK office with UK customers. But we're always looking for new ways to adapt our technology, innovative ways to meet new challenges. And when we realised that hospital-acquired infections, patients who acquire these are 7 times more likely to die, we realised that this was an area where we could apply our technology. Working with Wrightington, Wigan and Lee NHS Trust, we've started a pilot of a real-time bed management infection control system. The idea behind this is to improve the process and communication around infection alerts and bed management, ultimately reducing the infection alert times and the risk of infection and improving the level of care for the patient. One of the shocking facts that I found out was that 3 times more people die in the UK due to hospital-acquired infections than due to road accidents. One of the ways that we can reduce this rate is to provide better information to the hospital staff. Because one of the biggest things we need to do when you have an infection is to identify that infection early and take the appropriate action. And the only way you can do that is having good information to make that decision. Now, at the moment, the processes in hospitals are all based upon paper processes and phone calls. So when a patient is found to be infected, it's normally a verbal conversation across a phone, which is a highly inefficient process. And then there's decisions about when we've got an infected patient, where do we move them? Where are the other infected patients? Where's the best place to put this patient? How do we control this? And the other aspect of this is that the actual infection control teams, when they're doing the assessments, that's all done on paper at the moment, or normally done on paper. So what we're trying to do is bring all this information together, streamline the process so that the people making the decisions have got the information they need to make the right decisions quickly. The idea being we can reduce the infection alert time, which typically takes around 6 hours. We think we can bring it down to something like 6 seconds. Studies have shown that there's a direct correlation between overcrowding and infection rates. And hospitals with a bed occupancy of 90% or over have an MRSA rate 42% higher than the average. Now, high technology in itself doesn't provide the answer, but it enables hospitals to create more efficient processes. So the key thing is actually putting better process in place. So if you have an overcrowded hospital, it's about managing the flow of patients more efficiently, making sure a patient bed is available and generally stopping the log jamming of patients and the overcrowding. The second thing is it enables real-time information and good information about infections so that hospital staff know that currently they don't know that a patient had been in an infected ward, and now using electronic systems they could say, well, this bed has been infected, now we need to do something about it. Technology in itself isn't the answer. It's not a magic silver bullet to curing MRSA infection rates, but what it will do is enable better information to create better process.
Water treatment is critical. A hospital-acquired infection can be from another patient that enters the system. It can actually transverse itself up a water system, but mostly where it is in shower heads, taps, toilets, things like that. In the actual water pipes, The bacteria there may be of another form. It may not be MRSA or C. diff, but there will be bacteria there. But usually in hospitals, it is in the shower heads, taps, toilets, where it's easy to get the contamination for patient shoes in those areas. And that's why when staff clean them or cleaners clean them, they need to make sure that those shower heads and everything are clean. One piece of advice that I've always advised is if you have a shower head, turn the shower on full power, hot as you can get it, and leave it on for 2 minutes. That should kill most bugs in that shower head if it's absolutely at the highest temperature you can have. It also kills Legionnaire's disease as well.
Aquadition Water Treatment Limited are a second generation family company with over 35 years experience in water treatment. We are very pleased to be able to supply and install water softening equipment, reverse osmosis equipment, demin, de-alk, and also complete any requirements for Legionella and water hygiene control and bacterial control in all types of water systems. We are also very pleased to be an ISO 9001 company with LCA accreditation and CHAS accreditation. The dangers of Legionella bacteria in water systems, especially hot and cold water systems that we use on a day-to-day basis for washing and showering and cleaning, is that if it's not controlled and it's not kept down, then it can form a very serious infection on people that are susceptible and are exposed to that bacteria, which will lead either to them being very, very ill, or in some cases, and a lot of cases, actually death. The worst things that you can have is poor design of a system, complacency by the installer, and also complacency and ignorance by maintenance staff and people with the control of the money to put that maintenance, that proper maintenance in place. These are the things that are the danger, not the bacteria itself. It can be controlled if the right approach is made to the monitoring and the maintenance. The approved document for the control of Legionella bacteria in water systems, or the approved code of practice and guidance, is a document produced by the HSE, affectionately known as L8 in the industry. This is a very, very good document that gives you the guidance, the practical knowledge, and also covers the legislation aspect of the current codes. Bacterial control doesn't only mean Legionella. There are other bacteria that can invade your water systems that can also cause serious problems. The one that's come to the fore recently is a little bug called Pseudomonas. It was originally only looked at as causing a problem in chilled water systems, and really not a problem to humans. Unfortunately, this has changed in the last few years, and the bacteria is known to cause specific problems when it gets into swimming pools and spa baths, and also within your hot water system. So you need to be very aware that the documentation, the legislation that's available to you to help you control those water systems can be backed up by Aquadition Water Treatment Limited. But when it actually comes to the overall responsibility, whilst the healthcare have their overall corporate responsibility, they also cannot get away from the Corporate Manslaughter and Homicide Act of 2007. That act can be invoked right across the UK to any organisation where serious failings of their health and safety and ultimate death can really drop them sort of in a position that they wouldn't like to be in. When I complete my Legionella training awareness courses, one of the phrases that I repeat in that booklet is, "It could be you." So at the end of the day, if you are named as a responsible person for a water system or a cooling tower, a swimming pool or a spa bath, then you must make sure that the management chain above you or below you is completing the tasks that have been set out. As Aquadition Water Treatment Limited, if we as a company had a final message to people that are responsible for the maintenance and the management of their hot and cold water systems, it would be, get the documentation correct. Make sure that you are trained. Make sure you know what you're doing. And if you don't, get good advice.
Having purified air, clean air, is an old technology. Florence Nightingale in her nursing notes of 1860 something actually stated the best way to have a patient recover from a procedure or an operation is to put them outside in the fresh air. Now we do know that ozone kills bacteria, and the government know that because of the research they did in the 1960s with regard to chemical warfare, biological warfare. So we know that. We know there are machines made by companies that recycle the air and produce this ozone, and you can actually taste it a little bit in the environment when you're there, and it kills the bacteria. But there is no substitute for good, fresh air. Sadly today our hospitals are not designed for that. They're air conditioned or they're central heated, so it's a perfect environment for the bugs to breed. They're in their element because it's a warm, constant temperature, and they breed very nicely. Bacteria breed in a narrow spectrum of temperature. What we need to do is get the patient out of that, and sometimes putting them out into the fresh air where, even though it's a little chilly, wrapped up, will do them more good than leaving them in a hospital ward where there's thousands of bacteria or billions of bacteria. Get them into the environment.
SystemSolve is an industrial cleaning solution company that supplies to many NHS trusts, ambulance service, governments, schools, nursing homes, and other businesses as well, from manufacturing, all their solutions for health and safety and keeping their workplaces clean and tidy. Due to SystemSolve's experience within the chemical and cleaning business, we've worked hand in hand very closely with North Essex Partnership NHS Foundation Trust to do terminal cleans. The terminal clean is obviously when the superbugs are around, unfortunately, and through this methodology of working with their infection control team and our specialised cleaners, we've managed to reduce the amount of products that need to be used within a terminal clean, and also the time between outbreaks has now been extended over threefold. Air-Raid has been developed as a natural-based product, or from a natural-based product, to kill MRSA and C. difficile spores. Unlike chlorine-based products that are deactivated when they hit organic matter, Air-Raid does not have to have that problem. It comes in three different forms. It comes in a liquid form, and it comes in an aerosol form and a metered dose form. The handheld aerosol is probably the most unique and the one that probably more people will use because it has a very high pressure 360-degree valve. This means that it can get into the areas that are not normally covered by a normal day-to-day clean, such as the air vents, such as round the lights, in the plugs, round the computers, even on the computers. Because of its dry formulation, it doesn't affect any of the electronics, and it has a very, very rapid kill rate of under a minute. Early on, while SystemSolve was working with the NHS Trust to do these deep and terminal cleans, we were told, quite rightly, that chlorine is the product that is recommended by the Department of Health as it cleans and it disinfects. But we were also asked if there was anything we could look at or develop or had in our regime already that could be an alternative to chlorine. So we went along with my chemist and we looked at various products and decided in the end we'd develop our own. So we came up with a natural organic based product that obviously could do all these jobs, much safer for the people that were using it and for the environment it is around. And therefore also when large areas need to be done with fogging equipment, these machines can be extremely large, extremely expensive, and the time period between actually fogging and using the ward or reopening the ward again can be drastic and very expensive to the NHS trusts. So we've developed a product that can work very, very quickly, and in under 4 minutes the patients can be back in the ward. So after developing the product, we then came to Anglian Ruskin University for them to do all the scientific tests to get to the British standard that is required by the Department of Health.
Having worked in a clinical microbiology laboratory for the last 10 years and now moving to Anglia Ruskin University as a biomedical science lecturer, it's given me an insight into the common causes of hospital-acquired infection, such as Clostridium difficile and MRSA. And that's given me the insight to help people like Clive at System Solve to test his product to show that it's efficient against the common causes that are causing so much of a problem to patients in the hospital. And it's enabled me to add a bit more detail into understanding how these infections are spread and therefore testing the product in a multitude of different environments. My involvement with testing the Air Raid product was to test the antibacterial action against common hospital-acquired infections. We tested Clostridium difficile, including looking at the sporicidal effect, and MRSA as well, and showed that there was a 99% total kill of these organisms in an environment which would be applicable to being used in a hospital. Air Raid is rapid to use, gets in all corners, which helps prevent transmission of hospital-acquired infections, leaves a fresh smell, which is important for patients coming into wards, and most importantly is an effective killer of Clostridium difficile and MRSA.
Air Raid has been proven to have a 99.9% kill rate against MRSA and C. difficile, including the spores, in a very rapid time. The Air Raid range of products works hand in hand with the general cleaning products that are used by hospitals, etc. So therefore, rather than working against or perhaps neutralising the products, Air Raid works hand in hand very cost effectively, therefore reducing the amount of time and money spent by the trusts that could be actually put to better use.
The British Medical Association has warned that measures designed to speed patients through casualty departments or off waiting lists were limiting the amount of time hospitals had to clean and were thus detrimental in the war against hospital infections. The BMA's Science Committee warned that much trumpeted short-term moves, such as the deep clean of every hospital and bare below-the-elbow staff uniforms to combat hospital superbugs, would work only as part of a long-term culture change within the NHS. This is Georgina Burnett, and you've been watching Tackling MRSA and Other Hospital-Related Infections.